It used to be that people got sick later as adults, but now we're seeing more and more children with obesity getting sick sooner. So that, for instance, we used to call type 2 diabetes adult onset diabetes, but we don't call it that anymore because there's an epidemic of type 2 diabetes in kids now. So those kinds of health problems are starting to show up really in high numbers in children as well, and heart problems, higher, sort of higher risk of heart problems and heart disease in younger children, and so on as well. So we really, in order to prevent the sicknesses that come along with obesity, need to focus on preventing obesity. Parents really need to be thinking about not just their individual child's healthy behaviors, which I can talk a little bit about, but also what's the environment like and what can they do to change the environment. So going to the school, finding out what's on the school lunch menu, working with your school to make sure that the healthiest possible lunches are being served in the school. Physical education in schools. I know that the Chicago Public Schools are adding back PE and recess and things like that, and that's very exciting. But we also know that there's good ways and bad ways to teach physical education. So thinking about getting on board with, I think, statewide efforts that are going on to improve the quality of physical education, asking your PE teacher or your principal, when my child goes to a 30-minute PE class, how much time is actually spent being active in that PE class? Are my kids sitting on the bench waiting for their turn to go to bed? Or is the whole group playing soccer, so there's a lot of running around for everybody during the whole period and things like that? So there's different ways to think about that school environment and how that's contributing to how healthy your child is. Thinking about working with community organizations to bring in more grocery stores, or to work with all the local corner stores to change what's on offer at the corner stores so that they're not really promoting unhealthy snacks and stuff to the kids as they walk by and that sort of thing. So I think those are the kinds of environmental things. One of the good rules of thumbs is this concept that the Consortium to Lower Obesity in Chicago Children, CLOCC, has, which is 5, 4, 3, 2, 1. So 5 servings of fruits and vegetables, 4 servings of water a day, 3 servings of low-fat dairy, no more than 2 hours of screen time, and an hour of moderate to vigorous physical activity a day. So if you can remember 5, 4, 3, 2, 1 and what those go with, you can, that's what you want to think about as a sort of easy way to think about how to promote your child's health. Well, actually, sugary drinks are probably the single biggest source of sugar in people's diets, most people's diets, people who use them, and in the American diet overall. And they are definitely linked to obesity, and some people think maybe as much as 20% of the increase in obesity over the last 20 or 30 years, it could be linked to the increased consumption of sugary drinks. One of the other ways that I think is really helpful for parents and everyone to think about what they're drinking in beverages is a concept that's coming out we're using in a lot of communities, red, yellow, and green beverages. So red beverages are beverages you should rarely, if ever, drink, and those are the sugary drinks that I was talking about a few minutes ago, soda, fruit drinks, energy drinks, sports drinks, and that sort of thing. Yellow drinks are drinks that you should use with caution, just like on a slow down, think about it, rethink your drink, just like on a stoplight, and limit your intake. And those are diet beverages and actually 100% fruit juices, which have a lot of sugar. So they have some nutritional value, but they're also a lot of sugar and aren't really great to drink. It's much better to eat whole fruit than to get your fruit from a drink. And then green beverages, and those are the ones you should drink as much as you can of, as often as you can. Green beverages are water, seltzer water, low-fat dairy, 1% or skim milk, that kind of thing. So those are the kinds of things that red, yellow, green idea is something that would be helpful for parents. Oh my gosh, is that a red beverage? Maybe we shouldn't drink that. Let's choose either a yellow beverage, or even better, choose a green beverage.